One of the most common mistakes we see happen in a private practice is there's that lack of communication between leadership. You, the business owner, the practice administrator, communication not that great there, or maybe it happens every once in a while, or only happens when something goes horribly wrong. And then there's this complex communication with the team outside of that. There's so much value in giving autonomy to that practice administrator to truly run the practice. Welcome to another episode of the Physician Growth Accelerator, a show where we break down your private medical practice systems into vitals, give you the tools to diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe everything we experience in life is the perfect outcome of our current system. And the value in that, the power in that statement is we get to take responsibility for creating the outcomes that we want. All we need to do is step back and tweak the system. And if you're listening to this podcast, I'm going to assume that you're experiencing some level of constraint in the practice, some little feeling of a lack of business health within your private medical practice. And that can feel like difficulty hiring, keeping good employees. Maybe it seems like your reimbursements keep coming down and costs keep going up. And you're in this position where maybe a decade or 20 years ago, you seem to work less and earn more, and now you're working more and earning less. If you're feeling those things, go to physiciangrowthaccelerator.com and check your vitals. It might help you identify where you need to start in regards to tweaking your own system. And this might be a possibility. You might be sabotaging your own business. It's a pretty intense way to start an episode, I know. But here's what happens. You start a private medical practice, and in the beginning, it's not very complex. There's a couple employees, you see patients, and as you grow and the need for capacity grows, and maybe the need for space grows, and all this happens, complexity exponentially grows. I mean, imagine the conversations that can happen between 3 people compared to 5 people. It is much more complex. And what happens in private medical practices is we typically get into this path of, I need to hire someone. I need another of this. I need another of this. And it creates this organization where there's just a lot of people doing stuff and not a lot of structure in regards to leadership and accountability. And it gets so messy and so frustrating, and you're trying to focus on patients that you go, I need a manager. And so you hire an office manager or a practice manager or a practice administrator. And you typically find someone who's very organized. Maybe they have leadership experience. Maybe they just have organizational experience. But they come in and they try to bring order to this chaos. And many times you sabotage their ability to do that. That sounds a little harsh, but hear me out. This person is typically brought into a scenario where the complexity is very high, and bringing order to that scenario just off the bat is difficult. You're focused on seeing patients, and you have relationships with the people you've been working with. And it can kind of turn into, I don't know if you've ever experienced this, where a child will ask the parent a question that they want to hear the answer from. And so what we see very often is this in medical practices. You have an administrator trying to bring accountability into the practice, and you have employees who then go to the physician business owner to ask a question because they're going to like the physician business owner's answer better than the administrator. And what you're doing is you're sabotaging the value of that administrator when you answer the question or you give them that. And it might be uncomfortable for you. You might be in your mind, why are these people coming to me? I wish they would just go to the administrator so I don't have to deal with this. And the reason they're coming to you is because you're allowing it. And I always like to think about what is the structure of our behavior as humans. If you think about it, so our brain has 2 jobs. 1, stay alive. 2, make decisions that keep us alive using very little energy. That's it. Simplified, obviously. And what is kind of goofy about our brain is it treats non-life-threatening things as life-threatening. So you have employees right now that get defensive or are worried about something, and they ask you a question, and And it's literally from a point of evolution, it's their version of survival, their version of I need to stay within this pot of humans, this community that is safe for me. And maybe it feels dangerous to them to go to the administrator because the administrator has more accountability. They may just assume that means it's dangerous. And this is how we get down this path. And what it does is it creates problems in the organization because this is where drama, gossip, defensiveness, employees showing up late, employees calling out all the time. This is where it starts. And your administrator likely believes in what you do more than anyone else besides you, and likely wants to do what's best for the organization. And it's difficult for that person to try to reel a practice in when employees can go to you and get different experience. So one of the most common mistakes we see happen in a private practice is there's that lack of communication between leadership. You, the business owner, the practice administrator, communication not that great there, or maybe it happens every once in a while, or only happens when something goes horribly wrong. And then there's this complex communication with the team outside of that. There's so much value in giving autonomy to that practice administrator to truly run the practice. I mean, imagine what you feel about autonomy as it's related to treating patients. You know, if you were not given that autonomy, you'd probably change the scenario you're in. That's why you're an independent private practice owner. Well, the same thing with the practice administrator. Autonomy with that person to be able to do the things to achieve the goals of the practice is very powerful. Clarity for that person of what the goals are can actually help them in a huge way. If they don't know what the goal is, it's really impossible for them to put you on a path. You know, I've used example before. If you're wherever city you're in now and you want to try to get to Seattle, you need to know that you're trying to get to Seattle to get there. If you don't have that and you just go driving, it's not going to end it's not going to end well. Well, same thing with your practice. If they aren't given clarity around what it is their job to achieve, it's hard for them to drive the outcomes that's really creating that success. And remember, everything you're experiencing right now is the perfect outcome of your current system. So if you have a practice administrator and you feel like, hey, you know what, I haven't really given them autonomy, I would suggest sit down, have a chat with them, and ask them what would they do differently. Do they know where the practice is going? Do they feel like you've given them guidance around what you want to achieve short-term and long-term? And have you given them the tools to achieve that? And everyone loves their job more when you're in this scenario. This is when practice administrators are excited Sunday night to come in Monday morning because they have a mission. We're doing this. I'm achieving this. People like that. They like to understand where they stand and where they're headed. So if you think that maybe some of your behavior has sabotaged the administrator's value to the practice, that's okay. This happens all the time. Don't beat yourself up about it. Do something about it. Have a conversation. And if you ever want to discuss this stuff with us, please feel free to reach out. You can go to physiciangrowthaccelerator.com and connect with us there. And also check your vitals and just see if it starts to point towards a direction of where you may need to tweak your system so that you can get the outcome that you're looking for. Thanks, and we'll see you again on the Physician Growth Accelerator.